Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. So today we're going to talk about the ugly side of hospice. Here on the What the Dementia podcast, we try to provide as balanced of a view as possible so that you can make informed decisions. So I'm not going to pretend like everything in hospice is just hunky-dory because it's definitely not, and there are some things that you should be aware of. So just as a heads up, this may be a controversial episode for some people, and some people may find some of this information upsetting. So for that reason, I'll just say listener discretion is advised just in case, okay? So we're going to be talking about some unideal things that happen within the hospice space that could directly impact your partner and the best advice that I can give you to navigate these inefficiencies within the system. So this episode is definitely not to discourage you from using hospice in any way. I actually really love hospice when it's done right and ethically, and I do think it's a true gift for many, okay? Now, please understand that there's a lot that goes into this, and I'm doing my best to simplify everything. If I told you everything that I know and am continuing to learn, this would be like a 5-hour documentary and maybe even longer. So I'm really streamlining it to make it digestible, okay? So because of that, we're going to just focus on two things for this episode. So number one is hospices enrolling patients who are not terminally ill and do not actually qualify for hospice care. This is a big issue, and there's a lot of pressure put on hospice marketers and hospice liaisons to get physicians to refer people to hospice services and certify them as terminally ill as early as possible so that they can maximize the money they can make on these patients. Again, hospices are reimbursed a per day rate, so the less needs a patient has, which is often the case if they're being admitted before they actually need to be, the more money the hospice can make, up to a point anyway. So if you didn't know, creating false certification statements is fraud, enrolling patients who don't qualify for a service and billing Medicare is fraud, and providing kickbacks and incentives to physicians and medical directors for referrals and to certify unqualified patients, also fraud. It's all fraud. Even if they actually do qualify, the kickbacks, it's fraud, okay? But how does this impact you and your partner? Why do you need to be aware of this? So I've ran into many family members who feel frustrated when a hospice provider informs them that their partner doesn't qualify for hospice care. And they're like, what? How not? And on a bonus episode, I'm going to give you a specific example of a real case scenario, and I would include it in this episode, but I think it would make it too long, so I'm just going to hold it off for the bonus episode, okay? But when this happens, the number one recommendation I hear from both professionals and other caregivers is, well, if one hospice provider doesn't accept your partner, try another. And if your person truly qualifies for hospice and a provider is saying that your partner with dementia isn't eligible, then yes, by all means, please do. But how will you really know if they actually qualify or not? Well, you have three options. One, listen to podcast episode 126 and take notes. Two, join us inside the treehouse by grabbing a house or paw pass and download the hospice eligibility criteria and signs checklist. And so if you're interested in that option, you can join us at letsbamboo.com/treehouse. And or three, you can Google it. So you can type in dementia hospice eligibility criteria. But whatever you do, please do something, okay? It is so important that you understand hospice eligibility criteria for people with dementia, for yourself, so that you can properly advocate when appropriate. If your partner has another terminal illness, look up the criteria for that too, okay? Now, here's the thing. You actually don't want your partner prematurely enrolled into hospice, meaning you don't actually want your partner admitted to hospice if they don't qualify. And not just because it's fraud, That's not really your problem. That's on the hospice and the physicians, but it does open the door for hospice to play games if your partner stays on hospice services for too long. Why? Because what they are doing is already illegal, and the longer your partner stays on services, the more it threatens the aggregate cap, which is the max amount a hospice provider can receive from Medicare within a given fiscal year. And they also run a higher risk of being audited the longer your partner stays on services. Now, for hospices who do the right thing the right way, not really a problem. But can you see the issue for those who don't? Big problem, right? Now, if your partner actually does qualify for hospice at the time they are enrolled and they live past the 6 months, that's a whole different conversation because death is hard to predict. And that's not to say that you won't still run into issues, but it's just a whole different conversation, okay? So I'm talking about your partner being enrolled in hospice before they actually qualify. And understandably, it may feel like a good thing because you're getting additional support from the hospice, right? But oftentimes, especially if you don't choose the right provider, it can come back to bite you and your partner in the butt and at the worst time. Because again, the hospice provider may start playing games to save their butt. And also, did you know there are actually some hospice providers who do not accept dementia patients at all? And this is because people with dementia are known to have long length of stays and be live discharges. Now, you may think, well, isn't that a good thing? Wouldn't that benefit hospice providers financially, given the daily reimbursement rates? And unfortunately, there's a lot more that goes into it. One being that aggregate cap I mentioned. So it's definitely too much for me to try to explain in this episode, but please understand that after 6 months of being on hospice services, it's not always seen as a good thing. Although it is legal and allowed for people to be recertified and stay on hospice for unlimited benefit periods if they truly qualify, while this may sound good on paper, the logistics and realities of how this often plays out are not always favorable, okay? And that's where I'll leave it, okay? Now, the second thing is more unethical than it is completely illegal, but it's a common thing that happens, which is false promises as a marketing strategy, and some hospice providers have very aggressive onboarding strategies. So, some of you will run into hospice providers who will essentially tell you what you want to hear so that you choose them as your provider, or they may tell you things you don't want to hear because it may come in the form of threats, okay? And it's unfortunate that I even have to tell you that, but I've heard some pretty horrific stories of threats that were made to decision makers in regards to enrolling them into hospice, okay? And I would say that we see this most often in hospital settings where a decision has to be made quickly because, let's say, maybe Medicare is no longer covering that hospital stay. And if we're being honest, the hospital wants you out because unless somebody's going to pay out of pocket, you are now costing them money, okay? And that's just one example. But here is what I want you to understand. So I keep telling you that Medicare, Medicaid, and other private insurances reimburse hospices with this predetermined per day rate. This is an all-inclusive rate. So pretty much all aspects of hospice, so nursing care, medical equipment and supplies, medications, and all other involved team members like the chaplain, social worker, if there's a dietitian involved, therapist, right? They are to be covered under that per day rate by the hospice provider. Now, there are technically 4 different levels of care under hospice, but the most common one is routine care. And so this is not an exact number, but it's about $200 a day for every day the person is on hospice. That means that the hospice provider has a $200 per day budget to provide all aspects of care. That's not a lot of money, guys, and that's for all patients. So it doesn't change per condition or care needs. it's the same across the board. Can you see how that could cause some problems? For sure, right? And unfortunately, it does. This is why some people prefer nonprofits over for profits, because nonprofits are able to raise additional money to go towards things like medical equipment and supplies and care needs, special programs like music therapy, pet therapy, and art therapy. So sometimes the overall quality of care is a bit better, okay? Now, that's not to say that nonprofit hospices don't do their fair share of shady things, because some definitely do. But my point is, not all hospices are going to be able to provide such services the way they probably should and are expected to. And if they do, it's likely going to be case by case because they're not working with a lot of money by default with the way the system is naturally set up. Most hospices are going to be trying to control costs, and that will look different for each hospice provider, okay? So, with that being said, the easiest way to not get caught up in any bull that a hospice marketer or liaison or admission nurse may tell you is by doing your due diligence ahead of time before your partner with dementia actually needs hospice. That means being familiar with hospices in your area, asking questions ahead of time, looking at reviews, asking people who've used their services, and having an idea of which hospice you would want for your partner. Every couple of years, you may want to revisit that hospice you chose, or maybe you created a list, and see if their reviews are still good and if they still provide the same quality of care. Now, if you need help with questions to ask, you can go listen to podcast episode number 25. It's called Choosing a Quality Hospice, Top 20 Questions, or you can download our Choosing a Quality Hospice questionnaire from the Treehouse. All you need is a house pass, okay? But knowing which hospice or hospices you would likely want for your partner ahead of time is always a good idea. That way, if your partner ever ends up in the hospital for one reason or another, hospice is on the table, and you have someone coming in from a hospice pressuring you or feeding you all kind of nonsense, you can say, actually, I have another hospice in mind. Let me contact them first, and I'll let you know if we still need your services. Do you have a card? Okay? You have the right to choose your own hospice provider. So please do not let anyone come in and bully you into choosing their hospice, okay? Call the hospice you have in mind, tell them the situation, and see what they can do for you. But at least that way you know that you have a good chance of picking a good hospice provider for your partner. Now, let's say that with how life works, you never got an opportunity to do research and find a quality hospice, but now someone from a hospice company is in your face. You're stressed and confused, and at the time, their promises do sound appealing, so you opt for their services. However, once the paperwork is signed, you realize many of the services they assured you about aren't as they described, or you simply don't resonate with their approach and how they're handling things. Fortunately, there is the option to switch providers. As I mentioned in I think the last episode, your partner can switch hospice providers once during each benefit period, okay? And the way it goes is that you have two 90-day benefit periods and then you have unlimited 60-day benefit periods, okay? But those are the two things that I wanted to be sure to share for this episode. But besides the advice that I've already given you, the best advice that I can give you is to make sure your partner has a medical power of attorney in place or a guardian has been appointed if that's necessary, okay? I cannot emphasize enough how important this is, okay? Please, if your partner is in the early stages of dementia and you're listening to this episode because you're trying to be proactive and they haven't already assigned who they want as their medical power of attorney, It's time to have some tough conversations. If you need help facilitating this type of conversation, then I highly recommend that you check out the Conversation Project. Their website is theconversationproject.org, and they have a really nice conversation starter guide and a guide specific for dementia caregivers that you may find helpful, okay? But that is all for today's podcast episode. I hope that you found this episode helpful. If you did, please consider leaving us a review to help others find the podcast. If you have any questions, comments, or future podcast requests, you can send us an email at podcast@whatthedementia.com or contact us through letsbamboo.com. Thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.